I think we've used very effectively the UKTI and FCO to help support our international expansion, and I think that's part of the stepping stone. It's also about us doing the appropriate level of research and actually physically going out to these countries and understanding them before we make those investments. It's also about using our contacts as a business. Does being British help you win more work? Maybe opens a few doors, but actually we're competing on a global stage. Does being British help you get a business off the ground in a country? Yes, perhaps Britain is seen to stand for something and have certain values, but actually it's also about how we behave as OCS, how I behave as an individual, and how we're seen to lead the business that is also important. There's not a simple answer. Actually, there are a lot of ingredients on the table. It's about mixing them in the right way to get the end result. And OCS has done this in its own style and used all the ingredients available to it and used it very effectively to achieve our international growth and expansion. Well, we operate healthcare from New Zealand all the way up through Southeast Asia, back into the UK, which was our founding healthcare centre, and we're looking at taking opportunities in healthcare in both India and the Middle East at the moment. Yes, our background of having built a healthcare business within the UK has been extremely beneficial. Our association, we do a lot of work with the NHS and with private healthcare providers here, and that does give us a reference point and a skill base to move forward. It provides us with a number of staff that are keen to work overseas and take those skills internationally. And we've done this to great effect in places like Thailand, where we have a very big private healthcare coverage in the provision of services there, by providing latest ways of working, latest thinking behind healthcare, building maintenance, hospital maintenance into those markets. And now we're doing exactly the same as we start to look at the emerging healthcare market within India and the Middle East. Both are keen to grow tourism healthcare, both are keen to be seen to have global standards, and we believe we can bring that all together and help our clients in those markets achieve those goals. We just look around the world and see the way the healthcare market is growing. Most countries have a growing elderly population. Therefore, there is more of a requirement around old age care. We have a huge amount of expertise in this country. There's a huge amount of need around basic operations and general good health. And again, we have a proven track record in this country of skills around medical care, nursing care, just the application of medicines in general to apply into these emerging markets. Not in an arrogant manner. I mean, I think we can share this data with them. And for support services companies like OCS, we can use our skills that we've honed over the years here in the UK market and export them to complement other British companies that are promoting in the healthcare market overseas. So for me, the market is enormous. It's why we've targeted healthcare as a major sector for ourselves in the future. And these countries, Middle East, India, and to an extent Southeast Asia, they will replicate healthcare to a level that we have it, and then sometimes to a higher level than we provide it here within the UK. Well, I think first of all the NHS trusts have to decide in their own strategy whether they wish to go overseas or not. For me, it would be a very simple answer. I would say the answer is yes, there's a huge amount of opportunity. And I think in this time of budgetary constraints where they are looking for alternative income streams or looking at alternative venues for medical care to be provided, then going overseas, Middle East and India, will provide such opportunities for them. How can OCS help? Well, clearly we have our network of colleagues and people overseas. We have a knowledge of people who wish to grow healthcare businesses overseas. And I think it's about providing that link and giving confidence to, say, an NHS trust here that they can go there and replicate and achieve what they need to do. From an internal point of view, there's always going to be the argument about whether that is where the focus ought to be for the trust. But as a commercial argument, I think it's very easily justified. We have a world-class health service here within the UK. We have a great infrastructure here, and it is absolutely exportable, and it can work overseas. In terms of how can OCS work with people in achieving this goal, one is through the introduction and using our business network. And secondly, it's by supporting and giving confidence to perhaps an NHS trust that doesn't have international overseas experience and giving them that balance. We can provide that solution or that need and give them some guidance on how to operate. In terms of would I recommend 100% investment overseas, probably as a first NH Trust overseas investment? Probably not. I would look at joint ventures and working with local partners, because at the end of the day, a little bit like OCS ourselves, it's actually the knowledge we have which is exportable, and our ability to train and structure the solution. And we can do that by finding the right business partners in the countries in which we're operating and help train them and give them the confidence to replicate and grow something that matches our standards, our values and our ways of operating. Our healthcare business, our growth in healthcare is focused very much on Middle East, where we see huge growing potential and we need to really get onto that one straight away. India, where there is a growing market around healthcare, and for me, the Indian market will grow exponentially, whether it's tourism healthcare or whether it's local need healthcare for the growing middle classes, and Southeast Asia and North Asia, again, where they're looking to raise standards of medical care. They already have some wonderful first-class hospitals. They compete anywhere in the world with technology, equipment, nursing care, etc. But it's about bringing that on a wider basis throughout the whole of the healthcare operations within those countries. Healthcare is a growing industry around the world. UK is extremely well placed to take its skills out of this country and support that market expansion and be seen as the partner of choice anywhere around the world, whether it's OCS for support services or an NHS Trust for medical services or nursing services. We have all the skill bases here. We just need to package them, take them overseas and turn it to good advantage for all.